Okay, we'll start with POTS disease. Okay, you are seeing the whole screen, or it's like a short one? You can unmute
Whole
yourself.
screen.
Okay, whole screen. Huh?
Whole
You
screen. Whole screen.
whenever you want to speak, you can unmute yourself and you can speak to that. Okay, so we'll start with POTS disease. Okay, so tuberculous spine. Okay, so there's infection of bone. Okay, any infection in bone is known as osteomyelitis. Osteomyelitis, when you break it, osteomyelitis is osteo and myelitis. So osteo means bone, and myelitis is the infection. Itis is always the infection. So osteomyelitis is the infection of bone. Okay. So POTS disease is a problem of spine, and it is mainly related to tuberculosis. So tuberculosis of spine is known as POTS spine. Why it's known as POTS spine? Because Sir Cervical Pott has invented this one into spine. So in regards to his name, the disease is known as POTS spine. Also, the disease can be known as Cox spine, because Robert Cox has done tremendous work in tuberculosis. So tuberculous spine is known as in two terms as Cox spine or POTS spine. So these are synonyms. So some people say POTS spine, some people say Cox spine, some people say tuberculosis spine. So it's the same thing. Okay. So we start with the introduction. Okay. So in India, we know India is endemic for tuberculosis. Okay. So spine TB is the most common type of extra pulmonary TB. Okay. So normally TB affects all organ of the body, like starting from liver to kidney to eye to ENT, everything is affected by tuberculosis. But other than pulmonary, the most common extra pulmonary is spine. Okay, so if there's anything like MCQ, like which is the extra pulmonary most common affection of TB, it is spine. Okay, so TB spine is this. Other thing is TB spine is always secondary. Okay, so TB cannot infect spine directly. Okay, so either it is coming from the pulmonary area or it is coming from the hematogenous area, from pulmonary to hematogenous, and then it goes to spine, because in spine there are blood vessels. So normally TB comes in spine through hematogenous route. Okay, most commonly the thing is thoracolumbar. Why it is thoracolumbar? Anybody? Anyone? Why thoracolumbar? Because see, thoracic and lumbar is the thoracic is already, it is a junctional area. Thoracolumbar is the junctional area. So and the lower thoracic level, the blood flow is slightly on the lower side. So thoracic is mostly stable area and lumbar is mostly mobile area. So thoracolumbar D11 D12 is the most common area which is infected by the tuberculosis. So you just remember, from disc prolapse it is cervical thoracic area like C6 C7, or lumbar L4 L5 or L5 S1. For tuberculous spine it is always the thoracolumbar area like T11 T12. Okay, or you can remember at like, I can just give you this way. You can remember, if you remember TB. So yeah, this is TB. Okay, so TB is like TL. You can remember it as a mnemonic. So TB is TL, so thoracolumbar and tuberculosis. Okay, so the next slide would come as, okay. Okay, so my slide is changing or the same?
Sir, change, sir.
And yeah.
This is the
Okay. Okay, so regional distribution, the same thing. Okay, who is drawing this all lines here? Don't draw, because it will, I don't know who is drawing. Maybe I am drawing. Okay. So, so you come to this area. So dorsal area, it is the most common area. So you remember this one. So TB is thoracolumbar junction. Mostly dorsal area. Dorsal is no other name of thoracic. So some people say thoracic, some people say dorsal. It is a dorsal area. This is the dorsal area. Okay. So the most common area of TB is dorsal area or thoracolumbar junction. Okay. So the same thing. There's nothing extra into this. So you just remember thoracic area. Okay. So this is spinal tuberculosis. This is the kyphosis. It is known as kyphosis. So kyphosis is anterior. There is a wedging. This is known as kyphosis. Okay. So then in thoracic area there is a kyphosis because of the tuberculosis. This is same of the. So how will you do? How will you know the pathology? Pathology means how the disease spreads and everything regarding the disease. Okay. Just manage participant activity. So how the TB? So primary the TB infect the lungs. Okay, so it is pulmonary or somewhere other than bladder and everything it can infect. And from there via blood circulation it comes to spine. So in spine it comes through hematogenous spread. It cannot be direct spread. So TB in spine is always secondary, never primary. Okay. So TB is always secondary. This thing you should remember this. This is always secondary, okay, and it is via hematogenous route, okay. So TB there are many blood vessels and there are many venous plexus. The venous plexus is known as Batson venous plexus. So you remember the name Batson, okay, Batson venous plexus. So TB is always secondary, hematogenous route via Batson venous plexus. This is your Batson venous plexus. So these are the all veins, okay, which supplies to the vertebra. So it comes through Batson venous plexus. Okay. Now, what is the pathogenesis of? So what is the pathogenesis? So same thing. Pathogenesis is how the disease progresses. Since the disease infect the vertebral body and the disc, okay. So slowly it start eating the vertebra. The vertebra is going into the wedging. Wedging means normally it is a square. Normally your vertebra is like this. Okay. Normally your vertebra is square. It's like this. Normally it is this. When TB eats it, it becomes like this. Okay, so the next when TB eat your vertebra, it become like this. Okay, so it will anteriorly it become wedge. Posteriorly it will maybe okay, but anteriorly it become wedge. So there is a destruction of vertebra and the body goes into collapse. So whole of these things start collapsing. Okay, and it causing kyphosis. Kyphosis is this. Okay, so I will show you the next image. So you just remember whenever the TB enters the body, it start destroying the bones. Once the bone get destroyed, the anterior part start collapsing. Okay, when it start collapse, so there would be a deformity. Okay, so I will show you the next thing. Where is the collapse vertebra? Okay, I will go forward and then I will tell you. Okay, so this is what is this? So this is the same thing. The pulmonary abdomen, it comes via hematogenous or lymph node or direct spread, but most commonly it is by hematogenous by Batson venous plexus. Starting in the vertebral body, start destroying the body and starting the collapsing of the vertebral body. Also, it can causes abscess. Okay, it can causes abscess, and abscess can spread around that vertebral body. It can goes anterior, it can goes lateral, it can go posterior. So there is abscess. So whenever there is any infection, so tuberculosis is an infection which is a very chronic type. It is not an acute like staph and strep. It is a chronic type of infection. So any abscess which is formed, okay, it is very slow. Okay, there is not a very fast process like staph and strep that it is within one day the, the abscess will form or something like that. It is a very slow growing abscess, okay, and the abscess can percolate or you can say spread into anterior area, it can go into lateral, it can go into posterior. So your abscess can go anywhere, okay, there is no limit, it cannot go this area, it can go anywhere. So you should remember the abscess of tuberculosis is known as cold abscess. Why it is known as cold? Cold is something which is very chronic type. It is very chronic type of disease. So any chronic type of disease is mostly related to cold thing. Okay, it is a long going process and the abscess is not either within a 10 days or within a week problem. It is a problem of last 1 month or 2 months. It's like that. So The abscess of TB is known as cold abscess. Okay, so other than this, you come to the pathogenesis of TB. So same thing. So your the TB start from the blood hematogenous spread from pulmonary or bladder or anywhere. It comes into your vertebral, start infecting your disc, your body. So it start affecting your. This is the disc. Your disc would be infected. Okay, and your body would be infected. Okay, so your body would be infected. Okay, so after that the infection goes into the vertebral body, so your body and the disc would all be affected because of the tuberculosis. Okay, so the infection can go up, can go down, can go posterior, can go anterior, so you cannot predict from where to where it will go. Okay, the other step is, so once your bones start, because eat the bone. Okay, so your bone is becoming weak. Okay, the cortical, the medullary, everything will become weak and it start collapsing. Okay, so anteriorly there is a collapse. Okay, so your body, whose shape is, if your body shape is like this, okay, if it is shape is like this, it will start slightly bending forward, and this is known as your kyphosis. So it will start going into kyphosis because of the destruction of your body. Okay, okay, so the body start collapsing. Behind the vertebral body there is a spinal cord. As you all know, okay, the spinal cord go behind this. This is your spinal cord. Okay, this yellow color is going to spinal cord. Okay, this whole bunch of spinal cord, these are the nerve rootlets. This whole yellow thing is nerve rootlets. So this is like one nerve root, second nerve root, third nerve root, and this whole big chunk is your spinal cord. Okay, so whenever the it is starting collapsing forward now, so this is your nerve root. Okay, so this is your nerve root, this is your spinal cord. Okay, so as soon as the vertebrae start collapsing, so this would be stretched out, so your spinal cord would be stretched out. Okay, I will show you in the other one. So see this one. So you see this one. So this is so this red one is just a spinal cord. So it start compressing the spinal cord, and then there would be a functional issue. Like spinal cord, if you compress spinal cord or nerve rootlet, it have issue in the neurology. Okay, so till okay, so this one is okay. Even after healing, if sometimes if the disease get halted in this area, like if there is a collapse of that vertebra and you started treatment like AKT is started and the disease get healed. Okay, if the disease healed in the same position, okay, still there would be a compression of the nerve rootlet. So it is said that sometimes the vertebra heal but still the neurology persists. Okay, okay. uh my voice is not coming. Ayush, where is Ayush?
Yes, sir. Audible now. Sir, coming.
Ayush,
Audible, sir, audible.
Yes,
well,
sir. Audible.
okay, ठीक है. So we'll go for. अभी तक समझ आया क्या? You understand all this?
Yes, sir.
Yes, sir.
I'm going I am repeating the same words so that it stabilize in your mind. It will settle in your mind. I don't going very fast because of. Okay. So now you come to abscess. Okay. So you just remember one thing. This is paravertebral abscess. Okay. Why it is known as paravertebral? So around vertebra it is known as para. Okay, so there is some word known as peri. Okay, peri is surrounding of anything like perimeter, and para is just, I will show you what is mean by para and what is mean by peri. So let me draw. So this one. So this if this is your vertebra, think of your vertebra is like this. Okay, anything which is surrounding it, it is known as peri. Okay, and if your vertebra is like, if this is vertebra and anything side is known as para. Okay, so para vertebral abscess means anything inside of vertebra. It's not surrounding vertebra, it is side of vertebra. So it can be anterior, it can be posterior, it can be lateral, it can be both side lateral, means right side, left side. So paravertebral abscess means any abscess which is around the vertebra. Okay, So as you know, you all passed second year. So TB has the action of producing their granuloma and all that. Granuloma, tissue necrosis. It is just which type of reaction? I think type two. Type
So
two
type
response.
4,
Type. Huh? Which response is this?
type 4 hypersensitivity, sir.
Type four.
Delayed
Type
hypersensitivity.
4. Okay. So because of the granuloma and all that, with time they start producing abscess. Okay. So they start producing this paraspinal abscess. Para is the same word. Spine is the same word. So it is around the abscess, and it start collecting near about. Okay. It start collecting anterior, posterior, lateral, and medial. Okay. You just remember. So this is your way of seeing. So this is your abscess. So sometimes it goes anterior, sometimes it goes lateral. This lateral, posterior, only this. So it can go anywhere. Okay. So nothing to of remembering here. So it can go to cervical mein you can see there is abscess. Upper thoracic you can see, lower thoracic you can see. There is 2-3 things you should remember. Okay. So sometimes the abscess they produce is like this. Okay. So in thoracic area they produce abscess like this. It is a globular thing. Okay. So sometimes fusiform is called the bird nest. So if you see bird nest, they are like this. Okay. So bird nest की तरह they globular abscess रहता है. Okay. So they are known as bird nest abscess or globular abscess. So this what should you remember? Bird nest abscess or fusiform or globular abscess. Okay. Then cervical area, that's okay. So only you remember the word. Okay. Fusiform or bird nest. Okay. Then again comes to spread of cold abscess. Cold abscess is the abscess of spine TB. So it can goes into back. It can goes into in cervical. Cervical there are triangles. So it can go anterior and comes to the triangles of that. It can goes into axilla. It can go into chest wall. Okay, anywhere it can go. And one thing you should remember, what is psoas? Psoas एक muscle होता है. Psoas is a muscle which comes from thoracic area. So this is one thing you should remember. Psoas abscess. So this is psoas abscess. So psoas sheath. So psoas is a muscle which start from I think T10 to L4. So T10 to L4. So this abscess can come from thoracic to lumbar. Okay. And psoas abscess बोलते हैं उसको. क्योंकि psoas muscle में होता है, psoas sheath होता है, and the abscess come inside the psoas abscess. So it is known as psoas abscess. So psoas abscess is a very characteristic feature of the tubercular spine. So anywhere, any patient you feel there is a psoas abscess, it is 100% tuberculosis. No other problems can give you rise to psoas abscess. Okay. So this is psoas abscess. So this is psoas muscle from thoracic to lumbar tak jata hai. So any abscess in this area is because of tuberculosis. Just remember this thing. Nothing extra. Okay. So the same abscess and sinus formation, what are the complications of abscess and sinus formation depending upon where the sinus and abscess is. If the sinus or abscess is in the anterior, your cervical area, it can give you rise to the compression of. So what does abscess causes? It compresses the structures nearby. So if it is in anterior cervical space, it compresses your esophagus, the trachea. So esophagus they compress, it can cause dysphagia. If they compress the trachea, it can cause the respiratory issue. Okay. If it is in the mediastinal, there is a mediastinal abscess. Okay. Then mediastinitis can be there. Okay. Then if there is a problem in the pharynx, then there is a hoarseness of voice because of the retropharyngeal abscess and all that. Then it can cause psoas abscess, which I already told you from, and it can cause hip issues. Okay. So it is the same thing what I have already told you. Okay. So it's like in cervical area where the just some people are coming. Okay. So in cervical area, if there's a cervical area and the abscess go into anterior, so it can give rise to retropharyngeal abscess because pharynx is an anterior. Then paravertebral abscess. On side, it can comes to sternocleidomastoid. Okay. Posteriorly, it can goes into axilla neck. Okay. And laterally, it can goes into axilla and arm. Okay. So in thoracic, the same thing. If it comes into thoracic, anteriorly it is mediastinal. On side, it can go into psoas abscess. Okay, and the same thing. Okay. Nothing to in lumbar, the same thing. The prevertebral abscess, EAO, and all that, same thing. One thing you should remember out of all is psoas abscess. So anything where you find psoas word. Okay, so psoas abscess is a characteristic of TV spine. Okay, so you remember this one word only, psoas abscess. So psoas abscess means, so there is a cold abscess word for TV spine. There is a psoas abscess for TV spine. Okay. Other than that, you have to remember fusiform, the fusiform shape, the broadness shape, or the globular shape. These 4 points you should remember in the abscess area. Okay. Then this is the same thing, kyphosis and all that's the same. Okay. So there's two other word which is not anchor. What do you mean by fibrosis? There's something word known as fibrosis. Fibrosis means there's a fibrous what is a fibrous proliferation. Because of fibrocytes there's a proliferation and the body goes the process is known as fibrosis. And there's other process which is known as ankylosis. Ankylosis means bony formation. So you remember the word ankylosis. Ankylosis means bony formation. So any bones ankylosed, like if you say someone is ankylosed spine, yeah, ankylosing spondylitis. Ankylosing means it is a bony formation. Okay, you just remember. So ankylosis is a form of bony formation. Okay, so in tuberculosis, what happens? The TB is a type of fibrous because it is type 4 hypersensitivity reaction. So fibrocytes are there. So because of many fibrocytes, the body goes into fibrous ankylosis. Okay. Also, there is a bony ankylosis also and fibrous ankylosis. Both happens in TB. Okay. Okay, now comes to the clinical features. So if any tuberculous spine, if you have, so the most common thing because it affected the spine, so back pain and radicular pain. When does radicular pain comes? If your abscess is compressing the nerve root or spinal cord, it will gives you radicular pain. Okay. So depending upon which nerve root it is compressing, you got pain. If lumbosacral, then sciatic, upper, then arm pain and all that. Okay. Nothing too extra. Then stiffness, because if there is any abscess or any infection in the spine, the spine goes into spasm. Okay. Okay. Then what is night cries? Night cries. So what happens in night cries? It is a characteristic features of tuberculous spine. Okay. So in tuberculous spine, what happens in daytime? Your muscles are in action. Okay. So the pain what they do usually do, they mask the pain. Okay, because your muscles are active, so it masks the pain. So the pain is reduced in the morning time. Whenever you go into sleep, okay, your muscle got relaxed. Okay, once your muscle got relaxed, your spine goes totally unstable. In morning when your muscles are acting, your spine becomes stable because of the muscular action. Okay, once in night your muscle got relaxed, your spine totally become unstable, and then it start to paining you in night too much. So the characteristic history of tuberculous spine is night pain. Okay, morning I'm okay, but as soon as I sleep, after 2 hours, 3, I got severe pain in my back. So there is a typical characteristic of tuberculous spine, and that's why they had written this word cries. So actually, the pain is too much. It's give you a crying type of nature. Okay, that's why night cries. It's so it comes in night once your muscles relax, and it's crying type of pain. So that's why it's known as night cries. Okay, so night cries is a characteristic of tuberculosis. Okay, then there's formation of deformity, knuckle, gibbous, kyphos. These are the three different words for the same characteristic, kyphosis. So all do this. Some so knuckle, gibbous, kyphosis. Cold abscess I already told. One is paraplegia, one is paraparesis. What do you mean by paraplegia, paraparesis? Anyone? Anyone? Okay, so I will, so para means legs. Okay, so para means legs. Plegia and paresis are different words. So plegia means the paralysis is complete. It is 0/5. Okay, the motor power would be 0/5. Paralysis means there's a weakness. So motor power would be 1, 2, 3, 4, whatever. But plegia means the power is 0. So paraplegia and paraparesis. Sometimes people use paraparesis, sometimes people use paraplegia. Okay. So night cries हो गया, cold abscess हो गया. Okay. So now you move to the other thing. So this is your knuckle kyphosis I just told you. So knuckle gibbous and kyphosis. So kyphosis is something which is a broad structure. So kyphosis means it is a whole spine structure. So it is like spine का overall ऐसा हुआ. This is kyphosis. Okay. Knuckle means n से याद रखना 1. N is 1. So अगर एक सिंगल वर्टिब्रा का इशू होगा और या दो वर्टिब्रा का होगा जिसके कारण एक एंगुलर ऐसा डिफॉर्मिटी होगा, दैट इज नॉन नक्कल. If there is 2-3 vertebra मिलके अगर बनाता है, that is known as gibbous. So these are the different words. If you remember, it's okay. If you don't remember, also it's okay. So knuckle, gibbous and kyphosis. So mostly you have whole spine अगर ऐसा deformed है, then you call it kyphosis. Okay. Angular kyphosis इसको बोलते हैं. Angular means angle के साथ है kyphosis. Knuckle means single और 2 vertebra मिलके एक angular ऐसा बनाता है. So that is known as knuckle. Gibbous is 2-3 vertebra. Okay. These are the sub nomenclature of how you say things. Okay. So these are the same thing. Clinical features. You will see this. See this. There is a gibbous. Okay. So this is a swelling. This is a swelling sinus cold abscess. So cold abscess हो गया, ये gibbous हो गया, deformity हो गया, neurological हो गया. Once it is compressing your nerve root system, deformity. Okay. So these are the same features of your. This is a normal spine. These are the infection of spine by tuberculosis, and the vertebra is bending forward because of the collapse. This is collapsing because the vertebra eat all the bacteria. The TB eats all the vertebra, so it's going forward. So there is a kyphosis. So ये है अपना kyphosis मान लो. Okay. Now there is a types of pott spine. So depending upon the TB infect which area of the bones, there's a types of TB spine. So one is paradiscal. Every time I say para is means adjacent to that. So para vertebra it's adjacent to the vertebra या side में. Paradiscal means side of vertebra. So ये अगर disc means intervertebral disc. तो disc के जो बगल में अगर problem हो रहा है, so that is paradiscal. So I will show you. So अगर ये so see ये disc है तुम्हारा. अगर disc के problem यहाँ पे है side में, एकदम side में. Disc को लगे हुए problems है. So this is known as paradiscal. So any problem which is side of the disc is known as paradiscal. It is the most commonest type. ये याद रखना. It is the most commonest type जो disc के बगल में होगा. So paradiscal is the most commonest type. Okay. So central means body के center में होगा. Anterior means body के anterior में होगा. Posterior मतलब ये posterior lamina pedicle and all that में होगा. So remember this thing is paradiscal. Okay. So paradiscal means disc के बगल में and that is the most common. Okay. So these are the same thing. Paradiscal, most common is paradiscal, near to the vertebra, anterior, posterior. Sometime posterior को appendiceal भी बोलते हैं, appendiceal बोलते हैं. I don't know why it is known as. These are the different names of the same stuff. So you can remember posterior or you can remember appendiceal. So sometimes they write appendiceal tubercular spine. So you should remember this is the posterior part of involved, and it is not the appendiceal spine. Okay. Okay, so this is a paradiscal lesions. It is near about the disc base. Okay, so so the one most important thing of tuberculous spine is see. So the disc is always involved. Okay, so normally there are many problems of TB of spine. Like if you have malignancy, you can have other infection. So how can you differentiate tuberculous spine from others? So in TB spine, the most common is paradiscal, which is adjacent to the disc space. So these bacteria usually go into the disc space, okay, and destroy the disc space. Rest of other problems do not destroy the disc space, but in TB, it is a characteristic that discs are involved. So there is a disc destruction and there is a narrowing of the disc space, or you can say there is a narrowing of the disc space, or the disc height is decreased. Okay, so this is disc space narrowing. Your disc height would be decreased, or there will be complete destruction of the disc. So you remember one thing: paradiscal most common, and disc is always involved in spine. Okay. So there's a narrowing of the paradiscal, same thing. Paradiscal. So see, So see, so this is one vertebra, okay, and this is the other vertebra. In between there is normal disc. So between these two vertebra, the disc space has been obliterated. So there is no disc space. Okay. So there's no so this space narrowing, or you say obliteration of the disc space, is the characteristic of tuberculosis spine. Okay. So anterior lesion is same thing. The problems go into anterior of the spine. Okay. So ALL and all that will be infected. इसमें कुछ नहीं है. Now central lesion means vertebra के center में होगा. Okay. And because of the vertebra center में होगा, the vertebra start collapse and it become into, I will show you, there is known as vertebra plana. Plana means plane हो जाता है. Vertebra इतना compress हो जाता है, it will become plane. So you see this picture. Okay. So these are all vertebra. ये देखो कितना plane हो गया. So see, this vertebra is this much. Now because of collapse, it become like this. एकदम पतला हो गया. So this is plana. इसको वर्टिब्रा प्लाना बोलते हैं. तो वर्टिब्रा प्लाना ट्यूबरकुलर स्पाइन में होता है. ओके. एक दो और जगह होता है, बट इट इज नोन एज वर्टिब्रा प्लाना. सो इन सेंट्रल में क्या होता है, बॉडी डिस्ट्रॉय हो जाता है. एपेंडिकुलर लीजन्स मींस पोस्टीरियर, सारे स्पाइनस प्रोसेस एंड ऑल दैट इन्फेक्ट होगा. ओके. नाउ कम इनटू दिस प्लेन रेडियोग्राफ. ओके. सो प्लेन रेडियोग्राफ में यू हैव बोन डिस्ट्रक्शन, यू हैव अ डिस्क स्पेस नैरोइंग, abscess रहेगा. Okay. Now these two things I had already told you. These two things to remember. One is fusiform, that bird nest वाला जो बताया था, the bird nest formula. Okay. I don't know. अभी शायद time इसका कम हो गया. Less than 1 minute. It's showing less than 1 minute. So this is fusiform. Okay. This is fusiform. The abscess comes into bird nest form or fusiform form. ये पूरा ऐसा fusiform होता है. ये एन्यूरिज्मल फॉर्म होता है. एन्यूरिज्म कैसा होता है, आर्टरी का ऐसा होता है. ऐसा एक नॉर्मल आर्टरी रहेगा, ऐसा एन्यूरिज्म रहेगा. So sometimes this abscess comes into aneurysmal form or fusiform form. So you remember aneurysmal form, fusiform form, paravertebral abscess तो पता है, ये disc space narrowing ये most common thing है. ठीक है. इतना याद रखो. So now this is plain radiograph. Okay. Plain radiograph में क्या दिखने को मिलेगा? So you find aneurysmal phenomena.